Good evening. I'm Beverly Berry, the Associate Director of Diversity Outreach and Community Engagement at the Alzheimer's Association. Welcome to Alz Talks, and thank you for joining us for today's discussion on COVID, dementia, and caregiving presented by the Alzheimer's Association. We're joined by two dynamic special guests today, Dr. Carl V. Hill, who's the Chief Diversity, Equity, and Inclusion Officer at the Alzheimer's Association. And we're also joined by Dr. Weta Collins, who's a hospitalist and board-certified family physician. She's also a member of the AMEC Connectional Health Commission Steering Committee. Today, we will learn about COVID-19, caregiving, and dementia. And by the end of today's program, you'll be able to do three things: understand the relationship between COVID-19 and dementia, list tips for caregivers, and recognize Alzheimer's Association and AMEC's resources that can provide support. For those of you attending live, you are welcome to submit questions, and we'll have some time to answer a few of those questions at the end of today's discussion. As always, for specific questions or concerns related to Alzheimer's and dementia, help is always available via our confidential and free 24-hour helpline. So I want you to get out a pen and paper and write this number down. The number to our 24-hour helpline is 1-800-272-3900, or you can visit us online at alz.org. Dr. Hill, would you like to get us started?
Oh, absolutely. And thank you, Beverly, for that opening. Well done. I'm happy to get us started. Now, you may hear the words Alzheimer's and dementia used interchangeably. They are related, but they're not the same, right? So dementia is a general umbrella term to describe a collection of symptoms that are severe enough to interfere with daily life. So symptoms that impact a person's memory or thinking or reasoning, right? And so level setting here a bit, but there are many causes of dementia, but Alzheimer's disease is the most common cause, making up 60 to 80% of all dementia cases. So an estimated 6.2 million Americans aged 65 years or older are right now living with Alzheimer's dementia in 2021. And more than 11 million Americans provide unpaid care for people living with Alzheimer's or other dementias. So this is important data from the Alzheimer's Association's 2021 Facts and Figures report. So now we have been closely following the relationship between COVID-19, Alzheimer's, and dementia, and new research has provided additional information about the increased risk of COVID-19 for individuals living with dementia. The risk of contracting COVID-19 was twice as high for people living with dementia than those without it. This is partially because the symptoms of dementia can make it hard for persons living with the disease to adhere to the hygienic practices required to curb or prevent exposure. But also because of some factors or comorbidities that cause or contribute to dementia, including things like hypertension and diabetes, also increase a person's risk for contracting COVID-19. Still, also additionally, cardiovascular issues, specifically increased risk of symptomatic and severe cases, increase the risk of symptomatic and severe cases of COVID-19. So in terms of how COVID-19 and Alzheimer's disease impacts communities, we know both disproportionately impact African Americans. As reported in that Alzheimer's Association 2021 Facts and Figures report, really important report, Blacks are nearly 2 times more likely to develop Alzheimer's than whites. And we know African Americans are also at high risk for cardiovascular health issues, which may be reflected in the findings of that particular study. So interestingly, an international consortium was formed to study the consequences of COVID-19 on the brain and the nervous system in people at different ages and from different genetic backgrounds. So we will continue to get more information and learn more as time goes on, right? So some important, I think, findings about this relationship. I'm excited to be joined by Dr. Collins, who is a hospitalist and just a great clinician. Dr. Collins, is there any additional information you can share with our participants about steps to protect the health and safety of our loved ones, our individuals with dementia, as we continue to navigate this pandemic?
Sure. Thank you, Dr. Hill, and good evening, everyone. As Dr. Hill mentioned, there are several things that we can do to help protect our loved ones who are living with Alzheimer's and other dementias. As stated before, the comorbidities such as hypertension, diabetes, heart disease can increase risk. So in order to decrease that risk or to help decrease the severity of the disease, if the person becomes infected, we want to make sure that those comorbidities are well controlled, meaning that the diabetes is well controlled and managing, looking at your hemoglobin A1C, your hypertension, continue to take your medication to hit your target goals. And also consider making sure that you have a 90-day supply of medication, if possible, for those persons. And understanding that people with Alzheimer's disease and other dementias actually may forget, and they may need reminding to practice some of the pandemic safety precautions. So making sure that you remind them to wash their hands for at least 20 seconds, and even consider putting up a sticky note, say over in the restroom or bathroom over the sink, saying, hey, remember to wash your hands for 20 seconds. Placing hand sanitizer in accessible places, and even making sure that you may have a sanitation station at the door. And a sanitation station just really means you have a place where you have some sanitizer upon entry, some cleansing wipes, or even masks that may be available. Well, one of the big things that we've all been talking about over the past several weeks are vaccines. And we all know that vaccines have served an important role in protecting the health and safety of individuals with dementia, as well as the rest of the community. So think about the flu, which was a pandemic. It started off as a pandemic. The flu, the pneumonia vaccine, chickenpox, and there are several other vaccines that we all know about that have helped prevent disease. And so now we're here in this pandemic with COVID-19. And so we are highly recommending that those persons who qualify receive the vaccine. And certainly we want you to speak with your physician, ask questions during the question and answer period during this time, and set a list of pros and cons for the reason why it would be important for you and your family members to take the vaccine. I want you to understand the reasons for the vaccine and why we are recommending that you take it. The vaccine helps to decrease the likelihood of you being infected with COVID-19. However, if you are infected, it decreases the chances that you would have a severe illness requiring that you are hospitalized and or intubated. And so, in short, the reason for the vaccine is to keep you from becoming severely ill and or from dying. Dr. Hill?
Well, I tell you, Dr. Collins, the Alzheimer's Association strongly encourages vaccine use, particularly in communal settings involving skilled nursing or residential care. So in fact, resources are so important here, and we've compiled helpful numerous tips and topic sheets that can be found at alz.org/COVID-19, right? So that's a wonderful resource, alz.org/COVID-19. And our colleagues, the African Methodist Episcopal Church has resources also available at amecehealth.org/ALZ, right? So amecehealth.org/ALZ, too. Wonderful resources, free of charge, that everyone can certainly become updated around these tips and topics. And so we will highlight a number of these tips during today's program, right? So Dr. Collins, would you like to talk a bit about tips for caregivers?
Sure, Dr. Hill. So in regards to COVID-19, I want you to understand that this is a very fluid situation, meaning new information is going to become available every day. We do want you to follow the CDC guidelines and any of the guidance or rules that evolve in your local community. But when we're looking at people that are living with Alzheimer's that require having some assistance at home, then there are certain tips that the caregiver can do to decrease the chance of transmitting COVID-19. So we want to make sure that during this time that that you are cautious of any sudden increases in confusion or mental status changes in persons, and to make sure that you contact your physician immediately. Sometimes that may not be COVID, it could be some other type of infection. We want to stock up on medications, as we've talked about, and also have some plans. But during your home-based care, you can request, or you can even require that some of the providers in your home wear a mask or use PPE as necessary. You can ask to verify vaccine status. You can also ask that if they have any symptoms of COVID-19 that they do not present to work that day. You can also, in your sanitation station, be able to take a temperature, but making sure that everyone washes their hands frequently after eating or using the restroom is going to be most important. So the other section would be, caregivers, and some of us are not able to have persons in their home, and you're having to go to a community-based center or a memory care center or something like that with some of the out-of-home care options for persons living with dementia or Alzheimer. So this can pose a different risk in a communal type setting. And the risk is due to certain challenges with social distancing and among individuals living with dementia. So before making a decision regarding which community-based area to use, it's always best to visit that facility to determine your comfort level with the protocols. So you want to ask, what are your protocols that are in place to help ensure social distancing and personal hygiene? What if an employee or an attending begins to exhibit symptoms of COVID-19? What if there's a confirmed case or confirmed exposure? And so we want to make sure that we look at all those risk factors and then find a place that is comfortable for you as well as for your loved one that's living with Alzheimer's or another dementia. Dr. Hill, do you have any tips for loved ones in a residential care area?
Oh, absolutely, Dr. Collins. And I tell you, I recommend as a public health behavior student, implementing a simple daily plan, or a schedule that focuses on enjoyment, connecting with loved ones, friends, having a good laugh, and not only, those activities that are about achievement, right? And so thinking critically about some of those activities that are mindful of exposure to content or, any kinds of relations that are upsetting, right? And I think of, watching the news for too long, or, some of those scary and highly emotional movies or TV shows, right? And so as we're, certainly persevering here, being mindful about how we can cope around those activities that we enjoy. And then maybe also providing some extra reminders and support to help the person living with dementia to remember hygienic practices, right? And so there are a number of ways to provide reminders with the phone. We're all attached to phones, and the ways that we can remind our loved ones about these practices. So really important, I think, from a behavioral perspective. There are some things we can do, right? And so, Dr. Collins, do you have any tips to share for caregivers using home-based care?
Yeah, like I said before, it's your home, so you can make the rules and request that the persons use a mask and use that appropriately, covering the nose and the mouth, that you have a sanitation station at the front, and that you have your own personal protocol, like we talked about, that if the person coming in to assist with care, if they're having any symptoms of COVID-19, that they stay at home, or if they begin to exhibit symptoms while there, that they stay home. You can also ask and or require that the persons coming in to give care to your loved ones be vaccinated. So I think those are some of the important ones. And as we discussed earlier, if you're having to send family members, or if they're having to go to other areas such as a memory care center or an Alzheimer's adult daycare, that you understand the protocols that are in place at that facility. So I think those are some of the more important ones, Dr. Hill. What about if someone is actually at an inpatient or a continued care location?
Yeah, very important that right now during this time, as we're persevering through the pandemic. So thanks for that question, Dr. Collins. As residents and staff in residential care continue to be vaccinated, many residences are now opening for visitation, which is really encouraging. So given the ongoing risk of COVID-19 transmission and the fact that dementia-related behaviors may increase risk, visitors and caregivers should continue to make appropriate considerations and take additional safety precautions when visiting a loved one in residential care. So here's some tips that you can do before you visit. First, ensure that you've not had any exposure to anyone with the virus within the past 14 days. Also, if you're unvaccinated, consider getting tested and waiting for a negative result before you visit, right? And then also, third, check the community's visitation policies. You can do that. Many times they're posted online. Determine what safety measures you'll be expected to follow and prepare those items ahead of time. Also, determine approved areas where visits can be conducted, if possible, to identify areas outside conducive to visiting. So that's before you go, right? And then when you get there, during the visit, make sure you follow those community guidelines for visitation. Follow them very closely and limit your visit to the approved areas only. Follow the rules, right? And then if feasible, conduct your visit outdoors. If you can, go outdoors and connect with your loved one. Again, follow the current guidelines on social distancing and wearing a mask. And as always, maybe all throughout the year, wash your hands and use hand sanitizer often. Really, really important. So that's during the visit. And then third, after your visit, be cautious. If you begin to experience symptoms resembling COVID-19 within 14 days of your visit, let the community know so that you can take appropriate measures to monitor and limit the possible spread. So there's some important tips there before, during, and after your visit that we all should consider. Dr. Collins, what should people do if something happens preventing family from visiting their loved ones in residential care?
So this can happen, and unfortunately, I'm sure that someone on the call has experienced this during this pandemic. So if you find yourself in a position where you're not able to physically visit with your loved one in a community setting, then you want to confirm with the community residents, how will I find out what's going on? How will I know about any updates with my family members? You want to also consult and talk with them about options to communicate. Will there be an option for video chat or texting or phone calls or emails? So you really want to know what your options are to remain in communication, not only with the residents, but also with your loved ones. And so that's something that's very important that you establish in the beginning. And you also want to make sure that the care facility or care residence has your up-to-date information. You know, sometimes we switch phone numbers or do some other things that we forget to update. So making sure that they have your information as well as a second contact in case something happens and they're unable to get in contact with you. And so all of this, you know, it has caused a lot of stress. There's a lot of stress caring for a loved one with dementia. It is a lot of stress doing this in the middle of a pandemic, and it has put a lot of strain on people. So we know that there are some signs or common signs of caregiver stress, and we want you to be aware of them. They can include denial, anger, social withdrawal, anxiety, depression, exhaustion, sleeplessness, irritability, lack of concentration. And if it continues, you too can start exhibiting some health problems. It happens to some degree with everyone in this situation. So we don't want you to think that you are alone or that this is totally abnormal. But it's important that you remember that despite everything that's going on, that you take a minute, take a deep breath, and remember to take care of yourself. If you don't take care of yourself, then you can't help taking care of anyone else. And so during that time, and when you're feeling some of these stresses, we have to find a positive way to release some of the stress and to take care of ourselves and to help us to stay on focus or stay focused. And we can do that with physical activity. If you need to go take a walk, if you want to work in your garden, you want to go hiking, a bike ride, exercise, any kind of movement, yoga, stretching that makes you feel better, relaxation techniques, meditating, drinking tea, chamomile tea gives a nice calming effect. Sitting somewhere with a view that you love, or even just sitting outside on the back porch in the quiet and calm. Treating yourself to a bath or a shower. A bubble bath is one of the easiest ways to kind of relax. You can put on music if you want. You can light candles. You can read your favorite book, even if you're enjoying your home spa. So do all of those things. But if you've done all of that and you still find that you need support and help, do not be afraid, embarrassed to reach out. It does not make you weak. Okay, so we want you to be able to do this. And this is key. It's okay to ask for help and knowing what resources are available to you. And so Beverly, if you can assist us with some of that information.
Yes, exactly, Dr. Collins. Thank you. And that's why I want to share one of my favorite resources. And again, it's the Alzheimer's Association 24/7 helpline. And again, that number is 1-800-272-3900. This resource is available for persons living with dementia, caregivers, family, and the public. Specialists are available around the clock, 365 days a year, and are available to help with things like learning about the symptoms of Alzheimer's and dementia. Additionally, you're able to receive help in your preferred language through our bilingual staff and translation services, which accommodates more than 200 languages. So that's pretty amazing. Dr. Hill, do you have a favorite resource that you want to share?
Oh, absolutely. Thank you, Beverly. You know, I love to surf the web for my information and news, and I like to highlight the Alzheimer's Association website at alz.org. So there's a wealth of information available at that site, as well as a variety of tools and resources, whether it be our community resource finder. You can locate resources right there in your community. Our training and education center, as Beverly mentioned, you could get the latest education and information around Alzheimer's and other dementia, or ALZ Connected, All's Connected, our online message board community where you can get support and be in contact with others that are you're going through the same things you are, or having the same journey as you. The Alzheimer's Association website is a wonderful resource for all of us, no matter what community you're in. And I would certainly suggest that you visit alz.org. Dr. Collins, can you tell us more about the AMEC, International Health Commission, and where people can locate resources there?
Sure. The African Methodist Episcopal Church International Health Commission provides information for parishioners as well as the community regarding many healthcare concerns. And we have been fortunate enough to partner with the Alzheimer's Association to bring more information and research to the African American community. And so you can find information on amechealth.org/ALZ. You can also join us on the AMEC International Health Commission Facebook page, where you can also go back and review some of our previous podcasts and broadcasts regarding Alzheimer's and other dementias, as well as other healthcare concerns. So thank you so much for having us and partnering with us.
Absolutely, Dr. Collins.
Thank you, Dr. Collins. Thank you, Dr. Hill. So we've covered the main topics of this ALZ Talks, which has been amazing. And so now we'll take a few questions. So I'm going to look in the chat and just see what questions do we have. And I see that we have a few that have come in. And so the first question, this question, Dr. Collins, I'm going to direct it towards you. And this is a person that's asking about their mom. And they wanted to know if their mom could get COVID-19 from the vaccine.
No, you cannot get COVID-19 from the vaccine. I think sometimes people have some concerns because they hear of some of the symptoms that can occur with some of the injections, especially after the second one. So you have to think that the first injection is there to prime your immune system, basically letting it know how to fight. And so when you receive the second injection, then the body says, okay, I'm revved up, let's go, I can fight. And so you may have some symptoms of that transition or battle. And so some persons may have symptoms of fever, body aches, soreness, and those types of things. But understand that those symptoms resolve in anywhere from 24 to 72 hours. They are not ongoing and very short-lived, and the benefits in that scenario outweigh the risk.
Thank you. I have another question that has come in, and this question asks, is any one vaccine better than the other? So, we want to know Moderna or Pfizer, which one's the best? So is there one that's better than the other? Dr. Hill or Dr. Collins want to take a shot at answering that one?
Hey, I'll start and let Dr. Collins finish it up there. But, all of the vaccines, from my knowledge and perspective, have been reviewed and tested and approved by the Food and Drug Administration, the FDA, for safety and effectiveness. So there could be some slight differences in each, but in general, they're all very effective for all of the reasons that Dr. Collins just mentioned. So, Dr. Collins?
So there's not a better one or a worse one. The efficacy, especially between Pfizer and Moderna, are essentially the same. Where we start looking at and saying, should you get this shot versus another, actually becomes with the accessibility. Having the Johnson & Johnson vaccine that is one injection can be advantageous for persons who are unable to go back and get the second vaccine because of transportation or illness or physical disability or for some issue like that. And so receiving that one injection can be beneficial in those scenarios. But to say which one is better than the other, I tell people which one is available to you is the one that you should receive.
Awesome. Thank you both so much. We're at the top of the hour, but of course, you can always reach out through our 24/7 helpline for additional support and resources. I want to thank Dr. Hill and Dr. Collins for joining us for this evening and providing us with this very resourceful and great information that the community can use. Thank you all for joining us. Have a good evening.
Thank you.